Good to have you on this morning. Look, credit where credit is due. It does seem like the vaccination rollout here in the United Kingdom is going pretty well. Just bring us up to date with the latest.
Thank you very much, Neil. It is going well. We're vaccinating, on average, 140 people, that first jab, literally a minute. That's the average, so some areas are doing better. You'll see that improve as we open more of the large vaccination centres. 17 in total by this week, and of course 50 by the end of the month. It's a rapid rollout of the large vaccination centres, and of course primary care networks who are doing absolutely a sterling job to make sure they get to the residents of care homes, which are the top category, and those who look after them, and of course the over 80s. Now today, in some areas where they've done the majority of their over 80s, letters are going out to the over 70s and those who are clinically extremely vulnerable. But I don't want your viewers who may be over 80 and have not had a contact yet from their GP or from the National Vaccination Centre to worry, because we will make sure that they all get that offer of a vaccine by the middle of February. There's 4 top categories, but the number one obviously is care homes. We'll make sure that all care homes are vaccinated by the end of January. And then the over 80s, absolutely critical. So I don't want them to worry at all as we now obviously spread further to the over 70s.
Just on that point, and just forgive me if I'm wrong, you appear to suggest that, yes, letters for some over 70s will go out today, but only in those areas where a majority of over 80s have actually received the jab in their arm, not just received a letter.
Correct, absolutely right. So in parts of the country, all over the country, there's been some amazing primary care networks who've got to 90% of their over 80s. Some have already completed. In Darlington, they've done all their care homes, and absolutely brilliant effort there. So the areas that have got the majority of the over 80s done, letters will be going out and contact will be made by the GPs for their over 70s and those who are clinically vulnerable. In other areas, we're putting more vaccine, and they were standing up more primary care networks to make sure that they're able to vaccinate the majority of the over 80s and finish their care homes, and then move to the over 70s as well.
Now, of course, it wasn't you that said it yesterday. It was the Foreign Secretary himself. So you may disagree, but he appeared to suggest that the aim is that everyone has got that vaccine by September. Is that achievable? I mean, in fact, could we do it any sooner than that?
It is achievable. We are moving rapidly, and the NHS family, including, by the way, nurses, dentists, doctors, GPs, and of course the 80,000 volunteer vaccinators that have come forward, and the 200,000 volunteers from the public who've come forward, and whether through the Sun newspaper or other campaigns, are doing a tremendous job. So we're confident. We've got millions of doses coming through in the next few months. Of course, more of the Oxford-AstraZeneca, more of the Pfizer-BioNTech, but then Moderna, which has just been approved, which will come through in the spring, and others. We've got about 367 million doses that the UK government has bought for the 4 nations of the United Kingdom.
So in terms of the rollout of this vaccine, of course, as we mentioned, the 10 new mass vaccination centres opening their doors today, when might we get to the 24-hour rolling vaccination that we've heard, people from the Prime Minister down talking about?
So we're going to pilot the 24-hour vaccination. The NHS is going to pilot that in hospitals in London. And we'll look at how we expand that. But remember, Neil, the important thing is not just, once you go to 24 hours, you want to make sure you're targeting, really forensically, really carefully, those who you want to protect. So the over 80s have to be protected, and the 8 to 8 opening actually works much more conveniently for those who are over 80. And of course, then as you move down the age groups, it becomes much more convenient for people to go late at night or in the early hours. But at the moment, the challenge is obviously supply, limited supply of vaccine that needs to get into the arms of the most vulnerable 4 cohorts. So the targeting has to be really, really precise. so that we can protect them by mid-February. That's 88% of mortality. So, if you just want to, chase volume, chase speed, and not accuracy, 24 hours works really well. If you want to chase both accuracy, protecting the most vulnerable, and of course speed, then you want to do what we're doing, which is primary care networks, hospitals, large vaccination centres, and of course pharmacies last week, where we launched in 6. There's another 63 going live this week in community and independent pharmacies. And I pay great tribute to the pharmacy sector as well for joining in this battle.
Indeed, indeed. But just in terms of that, what you said about London hospitals being involved in this pilot, I understand no one wants to put a very specific date on things, but when might we see that coming on? Perhaps before the end of January?
Before the end of January, absolutely. We'll be piloting 24/7 vaccination. The NHS has done a tremendous job, and I'm grateful for this compliment. I take no credit for it. I was standing on the shoulders of heroes, which is the NHS family, who are delivering this extraordinary coming together, the best of British volunteers, the vaccinators, the doctors, nurses, dentists, pharmacists, all coming together to make sure we protect the most vulnerable cohorts as quickly as possible. 88% of mortality is accounted for by the top 4 categories that we hope to make sure that they get the offer of the vaccine by mid-February.
Of course, then the next very tricky question becomes who gets it after the top 4 cohorts. I mean, are we considering, for example, it's something we've talked about on the show a few times, giving the police priority? Is there potentially an argument for saying, people like yourself, lawmakers working in Westminster, should be vaccinated as a priority?
So we'll keep going down the next 5 cohorts. There's 9 cohorts that the Joint Committee on Vaccination and Immunisation have given us as the priority, based predominantly on age, and of course those that are most vulnerable, the clinically most vulnerable to death from the virus, because ultimately this is a race against death. Once we get through those 9, that's phase 1, and we're doing that at speed. As you can see, we're publishing daily data. Then phase 2, we will obviously work with the Joint Committee on Vaccination and Immunisation. But my very strong instinct, and I've said this to the Select Committee, is that those who through their work, through their profession, may come into contact disproportionately with the virus, policemen and women, shop workers, teachers, incredibly important, because we want to make sure schools reopen fully. They're now doing an amazing job teaching the children of NHS frontline and, of course, other frontline workers and the vulnerable children, but we want them open as quickly as possible. The Prime Minister wants us to focus on that. So my very strong instinct would be to say those through no fault of their own, other than their own profession, their work, have to come into contact much more likely to come into contact with the virus, should be prioritised.
A couple of questions away from your brief, if we can, Minister. Opposition Day debate on universal credit today. We understand that the government benches have been instructed to abstain. What is the current position on whether or not that uplift in universal credit is going to be reversed?
So the uplift is in place for another few months. The Chancellor has a budget on the 3rd of March, and he will obviously look at all the help we're putting in. We put £280 billion of help to help the economy and, of course, families cope with this extraordinarily tough time of this pandemic. It's unfortunate that Labour have chosen a sort of political stunt. This debate today has no real impact on the outcome for those families, other than a political sort of little stunt for Labour. I find it extraordinary. I was a few months ago, Neil, speaking to the civil servants who set up the universal credit infrastructure, the biggest infrastructure programme and delivery programme for the most vulnerable families in the country. And I want to learn from them how they did that. And when you talk to them and they hear Labour saying they will dismantle it, that they will get rid of it, they literally put their heads in their hands in worry about an opposition that is so reckless, that wants to dismantle universal credit. So this debate today really is unfortunate. Labour should be coming out and saying they will absolutely back universal credit. It's been one of the unsung heroes of this challenge of COVID.
Minister, you'll have noticed noted the arrest of Alexei Navalny, the Russian political dissident, on his return to Moscow. I wonder if you will join a number of other of our European partners in condemning the Russian government for taking this action.
Well, the Foreign Secretary will say more about this, but we are very worried about the well-being and safety of Alexei Navalny. And of course, we have to make sure that the Russian government answers why a poison was used against Alexei Navalny in Russia. The Foreign Secretary has been leading, I think, the world in terms of one, being robust on the Magnitsky Act, but also on holding countries that violate so flagrantly human rights. But you'll be hearing more from the Foreign Secretary on this.